Welcome to another session of Wednesday Night Live. In tonight's video, we're going to be covering tube feeding and nutrition for CNAs, patient care techs, and also caregivers. So, as we do in each of our videos, we're going to give you a few moments to receive your notifications, and we will get started shortly. For all of those who have passed your CNA examinations, we are so proud of you. So many of you all communicate with us. We just want to tell you to, just keep growing, give yourself grace. You're going to learn so much. And then don't stop learning. Next stop, nursing school or respiratory therapy school or sonography school. There's so many options for you. I have exciting news for you. 2 years ago, we had channel memberships. Well, now we are offering channel memberships again. We have two tiers. Our study buddies, $4.99. Our scrubs and ambition would be $9.99. If you want to learn more, you'll go to our channel, which is youtube.com/Florida training. That's Florida spelled out, and you'll get to know more about each of those tiers. If you want to have priority with your questions, if you want to join our Facebook group, depending on what you want to learn and what you want to do, you'll determine the best tier, the best membership for you. And I'm excited to have you as part of our membership community. So after this video, go to the homepage, go to our channel, and look at those different memberships. And our next video will be airing on Sunday, but only the channel members will see that video. They get to see it first, and they'll get to see it 3 days before the rest of the audience. So, channel membership is something you should consider. So many of you all have bought our vital signs bundles. I thank you all. So thank you. If you want to purchase a bundle, all you'd have to do is just take your phone, open up the camera app, and then just simply scan. Once you have your camera app open and you hover over that QR code, a website's going to pop up. Click on the website and you'll be able to purchase your own vital signs bundle. I know how hard it is to learn vital signs, to learn blood pressures, to understand what those numbers mean. And I try my best to help you here, but having the flow charts, having the study guide, having the practice test is going to be so beneficial for you. So don't delay. Go ahead and get your bundle today. And then just one more thing. You all, once you become CNAs, you sometimes are a little bit hesitant to go to nursing school. I totally understand. And so a area between nursing school and CNA would be maybe you want to learn EKGs, you want to learn phlebotomy, or you may want to just get out of the hospital altogether and go work in the doctor's office. So we've partnered with CareerStep to offer an online medical assistant training program. They have payment plans. They even have special programs. I want you to go to floridacareeracademy.com, or you can call one of our advisors at 877-225-7151. And now we're going to get started. I got all that out the way. We have our skills videos. There's no reason for you to fail your CNA test, regardless of what state you're in. Our step-by-step videos are free. Just use the QR code there. And now we have question number 1. So question number 1, what is the best position for a patient receiving oral feeding who is at risk of aspiration? Is it A, supine, B, semi-Fowler's position, C, high Fowler's position, or D, Trendelenburg position? Now I'll give you a few seconds to answer those questions. Put your response in the chat. Revealing the correct response in 3, 2, and that is right. If you chose C, you understand that the high Fowler's position is when we have a person sitting upright, whether they're in a chair or they're in the bed. So it's close to 90 degrees. So sitting upright during meals helps to prevent aspiration by keeping the airway open and thus reducing the risk of food entering the lungs. Great job. I see your comments there. Question 2. What is the purpose of thickened liquids for patients with dysphagia? Is it A, to make swallowing easier and prevent aspiration, B, to increase hydration, C, to improve taste, or D, to reduce the need for feeding assistance? Why would the patient have thickened liquids? Great job, team. You are absolutely right. It is A. So it's to make swallowing easier and to prevent aspiration. So thickened liquids move more slowly through the throat, thus reducing the risk of aspiration. And so your speech therapist, once the patient's been evaluated, the speech therapist will determine the consistency of the liquid. So whether it's going to be honey thick or they have different options. You're going to add the thickener, and based off of how much thickener you add, it's going to thicken the water, and it's flavorless. So you can thicken the applesauce. Excuse me, you can thicken the apple juice, not applesauce. You can thicken their juices, you can thicken their coffee, but if you just give them thin liquids, those liquids can go into their lungs instead of down into their stomach. So that is the purpose of thickening the liquids based upon the consistency that was ordered by the speech therapist. Question 3. What should a CNA do if a patient coughs while eating? A, lay the patient flat to prevent choking. B, encourage the patient to continue eating. C, offer water immediately. Or D, stop the feeding, encourage the patient to cough, and notify the nurse. Your patient begins coughing while they are eating. Absolutely. Stop feeding them. It's going to be D. So, if a patient coughs while eating, it may indicate difficulty swallowing or a risk of aspiration. The best action is to stop feeding immediately to prevent further choking or aspiration. Encourage the patient to cough. That's going to help clear their airway. And then, without you leaving the room, you're going to be pressing that button, calling a nurse. You're going to notify the nurse so that he or she can come and assess the patient. And then if any further interventions need to be taken, of course, your nurse will do so. And so those further interventions could be we place the patient on the NPO status, meaning that until they are evaluated, they can't have anything else to eat or drink because it's not safe for them to eat or drink. They may have to have a swallowing evaluation, or maybe we have them on the wrong diet. Maybe they got a regular diet instead of a diet that's for those at risk of aspiration. So that is what happens whenever you call the nurse. And that's why we have to work together to keep our patients safe. Question 4. How long should a patient remain upright after eating to prevent aspiration? Is it 5 minutes, 10 minutes? C says 10 to 20 minutes, and D says 30 to 60 minutes. Yes, a lot of correct responses. I am proud of you. We'll give you about 5 more seconds. Great job, team. Some of you all put C, but the majority of you all put D. We have to give that food time to actually be digested. So it's going to be D. Remember, people who are bedbound, their intestines, their stomach, it's not moving the way it would as if they were active. So 10 to 20 minutes is not enough time. So it is D. Keeping the patient upright for at least 30 to 60 minutes allows gravity to help move food from the esophagus or the food pipe down, okay, and it prevents reflux. So if you lay them down too soon, they can burp, the food can come back up, but when it comes up, it may not go back into the stomach. It can actually go into the windpipe, the trachea, and then thus enter the lungs. So everything you do is so important as a CNA, as a PCT, as a caregiver. So don't lose sight of how important your job is. Question 5. What is a common sign of aspiration in a patient receiving oral feedings? Is it A, salivating, B, coughing, clearing their throat, or a wet sounding voice? Would it be C, increased appetite, or D, high blood pressure? And I know this one's super easy for you, so we're revealing the answer in 3, 2, and yes, it is B. Coughing, clearing the throat, wet lung sounds. All of those are symptoms that suggest food or liquid may have entered the airway. Question 6. A patient with a swallowing disorder should avoid which type of food? Would it be A, pureed foods, B, mashed potatoes, C, thin liquids, or D, soft scrambled eggs? And it's a little bit late in the evening, but just reading out some of those food items made me hungry. So, what do you think would be best to be avoided if a person has a swallowing disorder? And we already talked about it. Yes, it is C. They cannot have the thin liquids because thin liquids will move too quickly and they can enter the airway, thus increasing the aspiration risk. Question 7. What is the most appropriate action when assisting with tube feeding? Would it be A, keep the patient lying flat? B, increase the feeding rate to speed up completion? C, keep the patient elevated at least 30 to 45 degrees during and after the feeding? Or would it be D, keep the patient elevated at least 90 degrees during and after feeding? Remember, this person has a tube feeding. This is not somebody who's being fed orally. I know this one's a little bit tricky. So I'll give you about 7 seconds to put your responses in the chat. All right, team, revealing the correct response in 3, 2, and it is going to be C. I know, a little bit more tricky. So when someone has a tube feeding and they're receiving feeding via the tube feeding, that's going directly into their stomach. So we don't have to sit them up all the way up at 90 degrees. Whenever we sit someone up for too long, their sacrum, their buttocks, that's going to be a pressure point. So if someone was being fed orally, we would sit them all the way up. But this person is bypassing their oral, it's bypassing their mouth, is going directly into their stomach. So 30 to 45 degrees would be sufficient. And then again, we won't be causing extra pain or discomfort by sitting them up the whole time. So here's your rationale. Elevating the head of the bed 30 to 45 degrees. Yes, it helps prevent aspiration and it allows for proper digestion, but it also decreases the risk of pressure injuries. Whenever you have somebody sitting up for too long, you're going to cause a pressure point. A bony prominence is an area where bone is touching bone or bone is touching bedding, and it is more at risk of getting a pressure injury. And your patients who have gastric tubes, they're getting fed through their stomachs, they have enough complications. We don't need for them to also get a bed sore from being set up too high for too long. Question 8. This is a scenario. Maria, a nursing student who also works as a CNA, that's going to be you, is assisting in the care of Mr. Johnson, a patient with a nasogastric feeding tube. Let's break those terms down. Naso, nose, nostrils, nasal, gastric. So there's a tube that's going from the nose to the stomach. All right, so Mr. Johnson, a patient with a nasogastric feeding tube. During morning rounds, the nurse asked Maria to check the residual volume in the feeding tube before the next feeding. Maria is unsure if this task falls within her scope of practice as a CNA. What should Maria do when the nurse asks her to check the residuals from a feeding tube? Is it A, politely inform the nurse that checking residuals is outside the CNA scope of practice and decline the task? B, attempt to check the residuals to help the nurse as she is also a nursing student? C, ask another CNA how to check the residuals and then proceed with the task? D, flush the feeding tube with water first before checking the residuals to ensure accurate measurement. What do you think, team? What do you think? And yes, you all got it right because you are safe caregivers. Look, you got to know your scope of practice. It is A. CNAs are not trained or legally permitted to assess residual volumes in feeding tubes, as this is considered a nursing assessment. Even though Maria is a nursing student, her role as a CNA at that place of employment dictates her scope of practice, and that does not allow checking residuals. The appropriate action is to politely decline the task and remind the nurse that this responsibility falls within their scope of practice, LPNs, RNs, etc. If you have taken additional training and your facility has taken you through a whole in-service and now they're adding that as part of your job duty, you would have already been trained on it. So if you've not been trained to do something, I need for you to decline it, okay? If the nurse is not teaching you how, it's not within your scope of practice, that is usually a telltale sign that you should not be doing it. CNAs are now being arrested and they're serving time. I just posted something on the community tab about that. And the CNA, she moved the patient in the Hoyer lift without help, and the patient fell, and the patient sustained a head injury, and the patient unfortunately died. You all, that was an accident. I don't know why she's in jail. More than likely, that facility was short staffed. The nurse wouldn't help her. So I need for you all to protect your licenses and protect your freedom. Okay, so don't just go out there and do things. We don't care how short staffed that facility is. I want you to make it home to your families, and I want those patients to be safe. So if you don't know how to do something, or if you need help, you're going to ask for that help, or you're not going to do the task. And make sure you document the reason that it wasn't done because you didn't have help, but that you notified the nurse who declined to assist you. That's a whole nother video for another day. I'm sorry, you all. All right, so question 9. A CNA's role in tube feeding includes A, adjusting the tube placement, B, administering medications through the tube, C, changing the formula when needed, D, assisting the patient with positioning and reporting issues. So whether you're in a hospital or a nursing home, you're going to have a patient with a tube feeding, and I need for you to know how to take care of them. So yes, you are right. Great job, Tasha, LaShawn, Maria. I see you. The answer is D. CNAs cannot administer feedings, but they can help to ensure that the patient is positioned properly, and they can report any concerns to the nurse. Question 10. A patient with a gastrostomy tube or a G tube complains of nausea and abdominal distension. What should the CNA do? A, raise the patient's head. B, lower the patient's head. C, pause the feeding and notify the nurse. D, massage the patient's stomach. And if hearing me reading these questions helps you to understand terminology, helps you to answer the questions better, don't forget that when you're taking your CNA test, you can ask your instructor, you can ask your school about the audio test. Okay, in the state of Florida, you don't have to prove that you need an audio test. You can just order it. You're going to click the button that says audio, and it's no additional fee. But sometimes having the questions and the answers read to you is going to help you choose the right answer. And so we know that we're going to be doing C. We're going to pause the feeding and notify the nurse because nausea and distension may indicate intolerance to the feeding or a blockage. Number 11, which type of diet is recommended for a patient with difficulty chewing? I know you're going to get this one. Is it A, regular diet, B, a mechanical soft diet, C, a high fiber diet, or D, a liquid diet? Your patient has difficulty chewing. Mr. Lucas does not have his dentures. And if he doesn't have his dentures, he should not be getting a regular diet. So it's not A, it's going to be B, a mechanical soft diet, because the foods that will be provided would be easy to chew, and they would also help to prevent the risk of choking. So the answer is B. 12, as a reminder, on your test, on your state exams, there are not any true or false questions. They're always multiple choice. But to break the monotony, I have a true or false question here. So here it is. True or false? A nasogastric or NG tube is inserted directly into the stomach. Is that true or false? All right, revealing the answer in 3, 2, and it is false. Rationale. A nasogastric tube, remember, break down prefix naso referring to the nose, gastric referring to the stomach. A nasogastric tube is inserted through the nose, down the esophagus, and into the stomach. It is not directly inserted into the stomach, rather, it passes through the upper GI tract. NG tubes are commonly used for feeding, medication administration, and gastric decompression. What does that mean? Maybe they have a bowel obstruction. They've been vomiting. We need to get all of that out of their stomach. Your nurse will insert an NG tube and then connect that to suction. We are decompressing their stomach, okay? If a tube is inserted directly into the stomach through a surgical procedure, it would be called a gastrostomy tube or a G tube, not an NG tube. So when you think of nasal gastric tube, think short term. When you think of G tube going directly into the stomach, think long term. Question 13. When using a feeding pump, the CNA should monitor for A, the rate and any signs of patient discomfort, B, changes in feeding formula, C, adjustments in the tube length, D, frequent patient repositioning. And I see so many of you all saying that you passed your test. Again, I am so proud of you. Congratulations, team and family. If you want to be spotlighted on our community post, we need to see send us a picture. You could be holding a certificate. You can just be in your cute nursing uniform or your handsome nursing uniform. Put on your scrubs, send us a picture, and we will post you. We will share your information. Let us know what state or what country you're from. We can't wait to celebrate you. All right, so for question 13, the answer is A. CNAs observe for feeding tolerance and report concerns. 14. Which of the following is the most common reason a patient would require a gastrostomy tube or a G tube? Is it A, the patient has mild nausea and occasional vomiting? B, the patient needs emergency gastric decompression due to an intestinal blockage. C, the patient prefers a G tube over oral eating to avoid chewing food. Or D, the patient has difficulty swallowing due to a medical condition. Whew, that was a lot. But I think you're going to get this answer right. My fingers are crossed. Oh, we're torn. We're torn. But the majority of you are choosing D. That is right. Think long term with a gastrostomy tube. So a G tube is placed directly into the stomach for long term enteral feeding in patients who cannot safely swallow or consume adequate nutrition by mouth. Conditions that commonly require a G tube include stroke, neurological disorders such as Parkinson's disease, head and neck cancers, or severe developmental disabilities. Gastric decompression, remember we talked about that, connecting it to suction in emergency cases is usually done with an NG tube, not a G tube. Number 15, a CNA should report which symptom in a patient receiving enteral nutrition. Enteral going into the stomach, okay? Enteric. Enteral nutrition, which symptom would you report? Would it be A, loose stool, B, no bowel movement in 3 days, C, normal bowel sounds, or D, sleeping through the feeding? Do you think that a patient who has a gastric tube needs to be awake while eating? No, we're bypassing their mouth. So it's not about them having a gag reflex. We don't have to check their swallowing ability. We know that they were unable to swallow safely, which is why they have the gastric tube. So the answer is not D. Great job. Yes, it is B. The lack of a bowel movement for 3 days in a patient receiving enteral nutrition may indicate constipation, bowel obstruction, or poor digestion of the formula. This can lead to discomfort. Impaction is a severe form of constipation in which our normal methods to alleviate the constipation won't work, and your nurse may have to go in and digitally use her fingers to remove the hard stool. And if that doesn't work, your patient will need surgery. So our goal is to not allow our patients to become constipated because they could have the severe form of constipation and end up impacted. So CNA should report this to the nurse so appropriate interventions such as adjusting the feeding regimen or providing bowel care can be initiated. Let's go to our next one, team. I am so proud of you. Another true or false. A patient with a feeding tube can never consume food orally. Is that true or false? All right, revealing the answer in 5, 4, 3, 2, and it's false. Yes, some patients with feeding tubes may still be able to eat by mouth. if their swallowing function is intact and approved by a healthcare provider. And so when I was speaking about speech therapists, the abbreviation is a SLP, so speech language pathologist often assesses the swallowing ability to determine if the patient can safely consume certain foods or liquids without risk of aspiration. And so they may only eat for comfort measures. It's not enough to provide them with the nutrition their body needs. But if they want some applesauce or some pudding or a popsicle, as long as it is allowed according to their plan of care, we're going to let them have that popsicle. But they're going to get their nutrition, their protein, their electrolytes via their tube feeding. Question 17. A patient with dysphagia should eat foods that are, is it A, dry and crumbly, B, moist and cohesive, C, sticky and tough? I don't even like how that sounds. Or D, large and chunky. I don't like how that sounds either. Your patient's going to choke if you give them something that is large and chunky or sticky and tough. So, do you think the best response is A or B? That's right. We're not giving our patients dry stuff because their mouth is already dry. They're on these diuretics, they're on medications that remove some of their bodily fluids, okay? And then they're mouth breathers and then they have on oxygen. So things are already dry. We're not going to make it worse by giving them dry food. The correct response would be B. It needs to be moist and cohesive. Think of grits, think of oatmeal. Everything is kind of like the soft scrambled eggs, moist and cohesive. These foods are easier to swallow and reduce the risk of aspiration. Question 18. A major risk of tube feeding is which? Is it A, increased appetite, B, weight gain, C, aspiration pneumonia, or D, muscle cramps? What is a major risk for a patient who receives tube feeding? All right. And I see you all putting weight gain. So it's really not B because we do daily weights. So they shouldn't be gaining too much weight because of their tube feeding because the calories and everything are calculated. Okay. Dietitians involved. So it's going to be C, aspiration pneumonia. If formula enters the lungs, remember it has sugar and all these other different nutrients, it can cause a serious infection, and we call that aspiration pneumonia. So when a person gets pneumonia because the food went into their lungs instead of their stomach, aspiration pneumonia is the term that you're going to hear. Question 19, true or false? A patient with a tracheostomy should be closely monitored when eating orally due to the risk of aspiration. All right. I hope you all know what a tracheostomy is. If not, you're going to be learning shortly. But you have to know these medical terms, not just to pass your test. You all are hilarious. You'll ask me a question like, is this on the test? And I'm like, girl, get beyond the test. You're going to be taking care of 15 patients next week. You're going to pass your test. I need you to know what some of these terms mean. All right. And so a tracheostomy is an artificial airway. They put a surgical opening in the trachea, and that is now how your patient's going to breathe. And so if a patient has a tracheostomy, the answer is true. They have to be monitored closely. Yeah, some of them can still eat. So patients with tracheostomies are at higher risk of aspiration because the normal swallowing mechanism may be altered. Food or fluids can accidentally enter the airway, thus leading to choking or aspiration pneumonia. CNAs and nurses. Look, if my patient has a tracheostomy and this is their first meal, I'm not going to let my CNA feed them. I'm going to be in there feeding them. That way I can monitor and, address any issues in real time. So CNAs and nurses must monitor these patients closely and follow dietary modifications or swallowing precautions recommended by the healthcare team. As a CNA, you would know what those swallowing precautions are. You know so by either looking at the orders or following your care plan. Another way we say that would be the plan of care. Question 20 is a long one, so just bear with me. What is the primary difference between bolus and continuous enteral feedings? A says bolus feedings deliver formula in larger amounts at set times, while continuous feedings provide a steady flow of formula over several hours. B says continuous feedings are only used in hospitals, while bolus feedings are only used at home. C, bolus feedings require a pump, while continuous feeding can be given by gravity or syringe. And then D states there is no difference between bolus and continuous feedings. Both are given the same way. What do you think? And since this was a long one, I'm going to give you about 8 seconds to get those answers into the chat. And I see some good responses so far. I'm so proud of you. Revealing the correct response in 3, 2, and yes, it is A. Great job, team. Bolus feeding involves giving larger amounts of formula at specific times, often using a syringe or gravity method. It mimics normal meal patterns and is commonly used for patients who can tolerate larger volumes of formula at once, while continuous feeding provides a steady and controlled flow of formula over a longer period, usually using a feeding pump. It is ideal for patients who have poor tolerance for large volumes at once or have a higher risk of aspiration. So this is what you're going to commonly see in home care. Your patient wants to be mobile. He doesn't want to be laying in the bed all day. So in home care, it's not 100%, but in home care, if your patient has a tube feeding, normally they would get bolus feedings. It may be every 6 hours. So they're going to eat 4 times a day. And then the rest of the day, they're not connected to anything. In the hospital, your nursing team really doesn't have time to bolus feed someone. And most of our patients are sick, so they can't tolerate a whole bag or a whole can of feeding at one time. So in a hospital or some of your skilled nursing facilities, they're instead going to have a pump, and we'll call it a kangaroo pump. And that pump has a bag attached to it, and your nurse will pour the designated amount of the food, the liquid food, inside the bag. And that's going to be gradually fed to that patient over a series of hours. Thus, it's going to help prevent the gastric distension, some of the issues. So hospitals would normally, not 100% of the time, would normally have the patients on a continuous pump. That's how they're going to get fed, versus home care would be bolus. 21. A patient receiving bolus tube feeding should be monitored for which complication? This one's a hard one. Is it A, increased energy levels, B, hypoglycemia, C, hyperglycemia, or D, decreased urine output? I know this one's hard. But remember what I told you was inside of the tube feeding? I said it had sugar. So we're giving someone a bolus of a substance that has sugar in it. So, yes, it is C. It is hyperglycemia. Look, as a CNA, you don't know everything, but you're going to report abnormal findings to your nurse. So, I need for you to understand why, when your nurse has a patient who's receiving bolus feedings and she asks you to go do a blood sugar, the reason that she's asking you to do that, okay, because we have to monitor to make sure their sugars don't go up too high. Here's your rationale. Patients receiving bolus tube feedings are at risk of hyperglycemia or high blood sugar because a large volume of formula is being delivered quickly, leading to a rapid increase in glucose levels. Many enteral formulas are high in carbohydrates, which can cause spikes in blood sugar, particularly in patients with diabetes or impaired glucose metabolism. They have a diabetic version. Okay, so I'm not going to quote the names here, but there is a diabetic version. So if the sugars are going too high, your nurse will notify the doctor if the doctor hasn't already done so, and then they will get the sugar free, or at least the one that has the reduced sugar and carbohydrate concentration. Question 22. A patient with a PEG tube who is showing signs of dehydration should be monitored for, and PEG is another way of saying G tube. Okay, so they have a gastric tube. What are you going to be monitoring them for? Is in relation to dehydration. Would it be A, increased skin moisture, B, excessive sweating and increased blood pressure, C, weight gain, or D, dry mouth, dark urine, and low blood pressure? Absolutely perfect. You understand your signs of dehydration. It is D. Dry mouth, dark urine, and low blood pressure are classic signs of dehydration, which can occur if the fluid intake is inadequate in patients on enteral nutrition. And just between you and I, whenever the nurse gives the feeding, usually it's going to be scheduled where, like, every 8 hours she has to give some water. Okay, she's going to add water. So, and then the patient may also be on IV fluids. So while they may not be able to drink water, just like we can put the formula, the tube feeding in the tube, we can also add water so that they won't become so dehydrated. 23. A pleasantly confused patient has accidentally pulled out their G tube. While waiting for the nurse to enter the room, what should the CNA do? A says cover the site with a clean, dry dressing and notify the nurse immediately. B says try to reinsert the tube to prevent the site from closing. C, leave the site open to air and continue assisting the patient with their activities. D, apply firm pressure to the site to stop any drainage or leakage and notify the nurse immediately. Ooh, this one is tricky. Ooh. All right. So I know what I want to do, but what I want to do is not the correct response, right? I want to do D. But think about it. It's not going to be like bleeding. If it was bleeding, that's different. If it's bleeding, you want to stop the bleed. But imagine you pressing on someone's stomach after their gastric tube came out. All right. And so that's going to be painful. So you're going to cover it. It's going to be A. You're going to cover it with a clean, dry dressing and notify the nurse. Now, if there's any bleeding, that's totally different. But this did not say the patient was bleeding. So a G tube site can begin to close quickly, sometimes within hours, which can make reinsertion difficult. The CNA's priority is to protect the site from infection and leakage by covering it with a clean, dry dressing and reporting the incident immediately to the nurse. The nurse or provider will determine the next steps, which may include reinserting the new tube or assessing the patient for complications. 24. A tube feeding pump begins to alarm while the CNA is assisting the patient. Which of the following are common reasons for the alarm? Is it A, the feeding formula has run out or the bag is empty? B, the tubing is kinked or clogged, blocking the flow of formula. C, there is air in the line, which the pump has detected. D, the pump battery is low or the settings need adjustment. And then E says all of the above. You are going to hear pumps beeping all day. As the CNA assigned to the patient with a beeping pump, get in there to try to figure out what's going on. No, you can't touch every pump, but at least you can make sure your patient's okay. Because if the tubing is kinked or clogged, the patient could be experiencing pain. The patient could have just disconnected everything. Get into that room. But the correct response for question 24 is E. That is right. Tube feeding pumps have alarms to alert caregivers. You're one of the caregivers of common issues that may interrupt the feeding process. Sometimes they could be laying on the tubing, and so you just repositioning them would get rid of that blockage, that kink, and then the feeding is going to flow normally. Question 25. A patient receiving tube feeding complains of diarrhea. What should a CNA do? A, stop the feeding immediately. B, encourage the patient to drink more water. C, ignore the complaint since diarrhea is expected. Or D, report the diarrhea to the nurse for evaluation of feeding intolerance. No, I know. Well, they're getting liquids. And if they're getting liquids, I expect for their stool to be liquid. So if the patient's having diarrhea, that is to be expected. It's false. Having, one or two watery bowel movements on a shift versus having diarrhea, that would be multiple episodes, totally different. So the answer is going to be D. Maybe the patient is lactose intolerant and there's lactose in the formula. So diarrhea can indicate formula intolerance, infection, they could have C. diff, or a feeding rate that is too fast. You got to get your nurse into the room. And you all, guess what? only our members are going to be able to see the next 25 questions. So that is right. I am going live, members only, on Sunday. We'll go live again Sunday at 6 p.m. And our members, our channel members, will be the ones who can attend. So for the others of you, you won't be able to see the second half until a few days later, and we'll determine. But if you're interested in a channel membership, all you have to do is go to our channel, which is youtube.com/Florida Training. You can choose to be in our study buddies for $4.99 or Scrubs and Ambition for $9.99. Remember, if you're part of the Scrubs and Ambition, you get access to our Facebook group. Never forget that caring CNAs become caring nurses. And that's what I want you to be. It's not about rushing. And I know this world is so tough and the patients can be mean and the nurses can be mean. But you know what? At the end of the day, I taught you better than that. So always show up, give yourself grace, give your patients grace. And if you watch for this long and you haven't liked, shared, or subscribed, go ahead and help a nurse out. You know how we do it over here. I don't care if we got 1 million subscribers already. It's not fun without you. So let's make it 1,000,002. So go ahead and subscribe to our channel. And thank you all for watching. I cannot wait to see you all in our membership community. It's going to be fun. We're going to be able to talk. We're going to grow together. We're going to get you from CNA to whatever your point is. We're going to do it as a team. And so this is Nurse Eunice. For our members, I'll see you on Sunday at 6. For everybody else, I will see you on next Wednesday night. Bye, everybody.